Okay.
If you wanted to change the name.
Oh, no, I'm just, no, I'm not on. Sorry about that.
Okay, the meeting is now. We'll start whenever you and Ashley are ready.
Okay, thank you.
Oh, you're on. Oh, you're on. Okay, gotcha. If I can control this.
Okay, just get my agenda up here. Give me one couple seconds. Ashley, are you ready?
Yes, I'm ready.
Good afternoon, everyone. I'd like to call the Health and Human Services and Aging Committee Wednesday, March 31st, 2021 to order. We have a tight schedule today because I know our presentation will probably fortify a lot of questions, and we have a committee of the whole sharply at 3. So my goal is to complete hopefully before 2:45 today to give everybody a 15-minute break. So let's all keep that in mind. Madam Clerk, can we have a roll call, please?
Pardon the roll, Ms. Howell.
Present.
Mr. Sweeney,
Present.
Ms. Brown,
Here.
Mr. Miller. Mr. Miller,
Present.
Ms. Stevens.
Present.
I don't see Ms. Stevens. She's absent at the moment. We have a forum.
Right, thank you. Approval of the minutes from the March 17th St. Patty's Day meeting. Can I have a motion and a second?
I so move.
Second by Brown.
Okay. First by Dale and seconded by Chantel. All in favor, please say aye. Aye.
Aye.
All right, minutes have been approved. We have a couple of items referred to our committee today. Madam Clerk, if you could please read the first item into the record.
Yes, and Madam Chair, just for the record, there was no public comment submitted.
All right, sorry about that. Thank you.
Resolution number 2021-0085, making an award on requisition number 3753 to AmeriCab Transportation in the amount not to exceed $8 million for non-emergency transportation services for ambulatory Medicaid eligible individuals in Cuyahoga County for the period March 1st, 2021 to February 28th, 2023.
All right. And who is to speak to this matter today? Who are all the names that could present? All right, David.
Madam Chair, so David Merriman, Director of Health and Human Services. I'm just going to introduce both of the items today just to say that I want to thank you for hearing both this item as well as the Lutheran Metro Ministry contract. I'm going to turn it over to each department to present their items and provide the detail on it. So I think Paul Porter is going to introduce this. Melissa will introduce the other. I'm going to go on mute and off video to save stream. And I also would remind all providers to please stay muted and off video until you're called upon. Thank you very much.
Thanks, David. So council members, committee members, this is a recommendation for an award and to enter into an agreement with AmeriCab based on an RFP that was completed for non-emergency transportation services or net transportation services. This is a 2-year contract for the period March 1st, 2021 through February 28th, 2023. The total not to exceed value of the contract is $8 million, $4 million per year for those 2 years. Net transportation is being recommended for an award. There were 39 RFPs released into the community and 6 proposals were submitted for this service. AmeriCab was the highest scoring proposal, and AmeriCab happens to be the vendor that had this contract most recently. As part of their proposal, AmeriCab has proposed using Faithful Phoenix as a subcontractor. They were a subcontractor under the most recent contract. And I believe Faithful Phoenix is qualified as both a minority-owned business and a woman-owned business as part of our procurement guidelines. Looking at the specifics of the service itself, we're expecting the vendor to provide up to 20,000 one-way trips per month focused on medical transportation. And this project is 100% federally funded through Medicaid dollars. I'm joined today by Kevin Gowan, the Director of Cuyahoga Job and Family Services, the HHS team that this contract is run through, as well as Patrick Keenan from AmeriCab, the vendor who's being recommended for an award.
All right. Would you, either one of you like to add anything? Director Cowan?
Sorry. No, Paul's covered it fairly well. It is a required service for job and family services to provide non-emergency transportation, and it is fully federally funded.
Okay. Paul, you stated that this were for non-emergency services. So this kind of covers when we have children in foster care and things like that. Can you explain a little bit?
Sure. So this is non-emergency medical transportation for Medicaid eligible residents. So it would be transportation to and from medical appointments that are not considered an emergency. So trips to and from dialysis, for instance, or a regular doctor's visit. Something like an emergency situation where you'd have to be transported by an ambulance wouldn't be covered by this contract. And how it works is the county sends a monthly roster to the vendor of clients that are eligible to book trips through this contract. And then the vendor works on the booking and dispatch for those trips with that roster of eligible clients. And since we're identifying who's eligible for the client, Medicaid eligibility is the critical piece, because again, this is 100% funded through those federal Medicaid dollars.
Okay, so the some of the children in foster care are Medicaid eligible. Are they utilizing this, or is that on the responsibility of the foster parent?
I might defer to both Mr. Keenan as well as Kevin Gowan about the specific population that's being served and the ages of those populations. I'm given to understand that it could include folks of different ages, but I don't know the specifics about the kids that are in foster care. Kevin or Patrick, do you want to add anything to that?
This is not specifically, this is Kevin Gowan, JFS Director. This is not specific to foster care. I think you'd have to speak to CFS and they're regarding their transportation services. However, any Medicaid recipient is eligible to apply for transportation services. And as Paul mentioned, for regular medical appointments, scheduled medical appointments, non-emergency, the population for Medicaid in Cuyahoga County stands now at roughly 420,000 recipients.
It was just a lot of money, so I was wondering what was all up under that umbrella of this contract. I'd like to open it up for any other questions. Councilman Sweeney?
Thank you, Madam Chairwoman, to Paul, Patrick, and Kevin. I've known Patrick for a long time. Can you tell me how this would function in your world when a phone call comes just from the assignment to the pickup? How does that work for your world?
Thanks, Councilperson. Yeah, Patrick Keenan, General Manager at AmeriCab. The way it works, the county sends to us a roster at the beginning of each month, listing the appointments, the people to be transported, and in that roster it also shows their pickup address and the destination where the medical service will be provided. In 2020, this most recent year, the number of trips that came in was averaged 13,159 per month. It was
Oh,
down
wow.
slightly from the prior year where we averaged 16,975. It has been showing an uptick in counts as the pandemic begins to lift. So the roster comes in, we assign the trips to our driver staff for transport. And then usually immediately upon receipt of the roster, there's additions, deletions, et cetera. So it's a living process. It's ongoing day to day. So we have a staff of, there's 5 of us that are involved in it, that 2 specifically that monitor the changes as they come in. So it's pretty labor intensive to stay on top of it. It's not etched in granite, that immediate roster. There's a lot of changes. So we're able to be flexible enough to service the additions and deletions, time changes, destination changes, et cetera. So once assigned, the service is provided and to and from the appointment as instructed.
Good enough.
So I hope that answers your question.
Oh, absolutely, totally, and gave me more of a perspective. Madam Chairwoman, one more?
Yes, go ahead.
Thank you. It seems it has to be fluid. I mean, just the sheer volume is kind of not shocking, but a lot more than I thought about. And getting a roster a month out, so there has to be a ton of, day of kind of changes, and you have to deal with that. So you should be commended for that effort to have the contract before and still doing it. You have to have it figured out.
Yeah, well, we're blessed to have a qualified staff here, and they're have a good rapport with the drivers, and we've done it for a period of time. So, we know the logistics involved in it and are able to respond promptly to it. But there are a lot of moving parts, as you can imagine.
Well, I like, just on a personal note, Madam Chairwoman, I like your new hip look with the little retro in the back with the Rolling Stones. So thank you, Madam Chairwoman.
Yeah, absolutely.
All right, and for Paul, is one trip considered just one going for, or a combination of to and from
Thanks,
the
Madam.
appointment?
The way we have it divided up is one-way trips. So I believe, Patrick, the amount of trips that you quoted was the number of one-way trips that you average per month, not the number of round trips, correct?
That's absolutely correct. Yeah, each one-way trip is counted as one trip.
And Madam Chairwoman, when the RFP was drafted, I know Patrick said they were around 13,000 during 2020 per month and had been about 16,000 prior to that. The RFP was drafted with an expected amount of up to 20,000 per month, acknowledging that some months might have more trips than other months. That way, we would make sure that there's enough money in the contract in case there is an uptick in demand, that the vendor would have enough money to deliver that excessive number of trips. If we base it just on the average that they were delivering right now, we might have to amend the contract if there was an uptick in demand. And again, the contract is written as a not to exceed dollar amount. So that doesn't mean we will necessarily spend the full 8 million over the life of the contract. It's just that we can spend up to and not to exceed that amount based on the demand for these services.
All right, is this reimbursable? Or do we, is it a setup as we spend the money and then we're reimbursed by the federal government, or they're sending the funds directly?
Sure. I believe that's the way it works. Kevin, are you able to confirm how the finance piece works? I know we enter into the agreement and the check comes from the county coffers. And then I believe the budget line that it comes from is federally funded through Medicaid. So I'm not sure if we get an upfront allocation at the beginning of the year and just draw that down, or if this is paid as a cost reimbursement.
Paul, I believe you're correct that we have an upfront money and we get reimbursed as the year goes on. I can circle back around to fiscal to verify that, but I believe you're correct in that assumption.
Madam Chair, I'll follow up on one of your questions.
Yes, go ahead.
Thank you. Patrick, how do you handle, because per trip, right? back and forth. Are there ever 3 or 4 legs? And then if someone is getting a dropped off, hey, can you give me a ride over here? Do you need approval? You just say no? How does that work?
Yeah, thank you for the question. Yeah, we're not authorized to provide any service outside the parameters defined to us. And the parameters defined to us are very clearly the home or pickup address of the client, which is on file with Medicaid, and then to the destination. Not that they don't frequently ask for additional services, but we're not allowed to provide them.
Thank you. Thank you, Madam Chairwoman.
All right. Any other questions?
Madam Chair,
Councilman Miller?
thank you. My question is, who were the other bidders on this contract?
Thank you, Councilman Miller. Let me look at the tabulation sheet so I can give you the full count. So going alphabetically, AmeriCab Transportation, Curb Mobility LLC, Emmanuel Ventures Limited, Freedom to Go Transportation Services Corporation, Future Age Incorporated, doing business as Provider Ride, and then we put Family First Transportation Services.
So that's, sounded like a total of 5 or 6. I thought you said that there were 8.
A total of 6. So we had 39 RFPs that were sent out. So this RFP was sent out to 39 different agencies, and we had 6 responses.
And could you describe the scoring process?
Sure. So for an RFP, we don't look at just any one metric when determining our awards. So it's not based just on pricing or just on capacity. We evaluate the entire proposal. So part of our scoring process was to establish review teams with several different members who evaluated each of those proposals and gave a score to each bulleted area of response we were looking for the proposal to respond to. Each RFP typically has 25 or 30 different points that we're looking for the proposal to address. Each one of those is scored individually, and then a final score is assigned to the overall proposal based on that. In this case, the award recommendation is going to AmeriCab, which was the highest scoring vendor overall. And again, we do try and make it a transparent process with multiple reviewers. AmeriCab was not guaranteed to get a contract as the prior vendor for this service. And indeed, that's not a weighted section of the scoring process. The scoring is based on the proposal itself, not our history with any one agency.
And what score did AmeriCab receive, and what was the range of scores for the other bidders?
Sure. Hold on one second. Let me pull up that score sheet. AmeriCab's score out of 100 was 84 points, and the range of scores for the other respondents ranged between 29 and 74.
And how many reviewers were there?
Let me count up the total. 13 total reviewers.
And of the 13, how many of them rated AmeriCab in first place?
We don't typically do the scoring like that, where people put the individual proposals in ranked order. Our scoring process involves a group discussion based on the individual reviews, and the group comes up with a consensus score for each of those bulleted scored areas of the proposal. So we don't base the awards on any one individual's assessment of a proposal. It's a group review and scoring process.
Understood. And final question, which bidder came in second with 74?
Let me go back to that sheet. Sorry, I'm navigating on my computer screen here. That was Emmanuel Ventures was the second highest respondent.
Okay, thanks very much.
Thank you.
All right, I'd like the record to reflect that Councilwoman Stevens is in attendance. Are there any other questions in regards to this contract? Seeing none, and by looking at the date, Paul and Administrator Merriman, you need this under second reading suspension, am I correct?
If we could get this approved with second reading suspension, yes, that would be best because of the March 1 March 1 start date of the contract.
All right, and how many, one final question, how many years has AmeriCab been participating with us or received the contract?
Patrick, do you know the exact number off the top of your head? If not, I can look it up.
No, we were brought in on an emergency basis approximately 14 years ago. And then we've been awarded the contract every 2 years on a competitive bid process since then.
Okay. Thank you. And thank you for joining us today, taking your time out.
Thank you.
I'd like to move this to the full council under second reading suspension. Is there a second?
Second.
Okay, seconded by Councilman Sweeney. All in favor, say aye.
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 All right, delayed ayes, but it is moved on. Thank you very much for that. Madam Clerk,
you.
if we can move to the next item.
Here, Pat.
Resolution number 2021-0086, authorizing an award on requisition number 3912 to Lutheran Metropolitan Ministry in the amount not to exceed $3,958,232 for operations and case management services for a 365-bed men's emergency shelter located at 2100 Lakeside Avenue, Cleveland.
Madam Chair, this is Paul Porter from Health and Human Services Contract Administration and Performance. I'm going to turn it over to Melissa Sirak from the Office of Homeland Services to handle this item.
Thank you. Welcome, Melissa.
Good afternoon, everyone. Again, Melissa Sirak with the Office of Homeless Services, requesting a contract for emergency shelter services to Lutheran Metropolitan Ministry. The primary goals of the emergency shelter program are to provide safe, trauma-informed, low-barrier emergency shelter, develop and implement a permanent housing plan with each person, and link clients with community services to secure sustainable income and physical and behavioral health services. The men's shelter operates 24/7 and is staffed at all times. The ADA compliant facility is organized around housing exits with 6 dormitory-like communities. Clients develop housing plans and are provided supportive case management services. Historically, capacity has been met daily at 365 beds, and additional overflow mats are provided as needed off-site in partnership with St. Paul's Church. Capacity has roughly decreased by 50% over normal operating levels due to the use of off-site COVID alternative shelter sites. Mentioning the alternative sites, I should also mention that lastly, the continuum of care is strong and has proven to be resilient, nimble, and creative during these times. LMM specifically has served as a linchpin for our overall COC COVID response. They have served as strategists in several of the initiatives, including the hotel deconcentration, which also impacted YWCA Norma Her, the COVID hotel, as well as looking at long-term permanent solutions to provide shelter operations. In addition, they've served as the fiscal conduit for all of these initiatives to ensure that financially funding flows most easily and readily available to the providers that are involved within the continuum itself. With me today, I'm grateful to have Michael Searing from LMM.
Welcome, Michael.
Thank you. Glad to be with you.
All right, Melissa, are you done with your presenting?
I am. Thank you.
Okay. Mike, you did join us. Can you add anything additionally to Director Sirak's comments?
Yes, thank you. I'd be glad to. Just an overall comment, just I really appreciate Melissa and her staff partners, leadership for the whole continuum. Everyone's working together really well, and I think the collective strategies have been really successful. So much appreciation there. A couple just real quick data points, mostly around the success of the deconcentration and the hotel initiative. We've been able to reduce shelter concentration at both 2100 and the women's shelter in partnership with the Y by about 50%. So that's been really critical to keeping no COVID outbreaks, probably about maybe 7% positivity rate. So no spikes there. The hotel response continues to be in play. We keep track of our daily census at both. The hotels as of Friday were at 237 people, and at 2100 at 153 people. So obviously we're able to have a lot of people placed at the hotels during this time. A couple other quick data points. During 2020, our central kitchen program was able to pivot and provided nearly 250,000 meals to people in the hotels. So they changed their meal service from solely the congregate setting to individual room deliveries, and we served about 700 unduplicated people in the hotels. So I'd be happy to take any other questions, but that's a brief overview.
And in terms of the contract amount, is it for 2 years or one? It's not stated. The 3.9 million?
Oh, Melissa, I think you're on mute. I believe that's one year.
Yes, I apologize, Madam Chair. I was looking to confirm. There's a levy service funding involved in ESG Care CV2, which yes, should be for a year. I also have Aaron Reardon on the call that could add anything regarding the time frame.
Aaron, would you like to chime in?
She might be muted.
Madam Chair, I have a follow-up question.
Okay, you're having some technical difficulties. We can't hear you, not clearly anyway. So we'll come back to that. We'll give you a second to.
Madam Chair,
Yes, Councilwoman.
it appears legislation that is from January 21st through September 3rd, 2022.
For whatever reason, it's not on my.
It's not in the summary, but it's in the actual resolution.
Okay, thank you. Councilwoman Stevens.
Yes, could we get a summary description of what can you hear me?
I can hear you fine.
Okay, just wanted to make sure. Can you have Mr. Steering or Ms. Sarek give us a summary of what the case management services are? What kind of assistance are they getting? Is it counseling? Is it a job counseling? Just what is it?
Sure, thank you. I can give a quick answer to that. So everyone has a housing plan. So it's like a case management plan focused on their housing, and utilizes the other continuum partners, permanent supportive housing, and all of those partners, as well as independent housing. So anything that they need to support the housing plan, which often includes job search or mental health services or referral for other things, that is in the plan. We have a software program to keep track of all of our case notes and our outcomes as well.
All right.
Madam Chair, if I may confirm the time frame for you,
Yes.
is that okay?
Thank you.
Okay, so the HHS levy funds are for 1 year, and the ESG CV2 is good until 9/2022.
Okay, yes. I looked it up, Councilwoman Brown brought my attention to it. Oh, yeah, I looked it up. It's usually in our heading though, which was kind of different. And I don't know if that's the background from the person, Aaron, that you wanted to talk or no. All right.
I don't hear any.
Okay, so Director Sirak answered my questions in terms of how this money would be divided, and it is divided amongst the partners with this situation. Is there any other questions in regards to this legislation? All right, seeing and hearing none, we will move this to the full council under second reading suspension. Is there a second?
Second.
Okay, seconded by Councilwoman Stevens. So I'd like to move this to the full council under second reading suspension. All in favor, please say aye.
Aye.
Aye. All right, and I would like to ask that Director Sirak and as well as Mr. Searing, please continue on. Possibly also David, in regards to the conversation and the presentations that will follow up with the city of Cleveland, so we can all be on kind of point. And I don't know if Director Gowan would need to be included on that, but for the city of Cleveland vaccine and the distribution protocol, I think you guys, that's kind of what spurred me to want to have them as guest speakers so we could all be on the same page in regards to that. So I hope that you can. I urge it. So if we can go ahead with that, is that okay, everyone?
Yeah, Madam Chair, we're happy to
All
stay
right.
on. I think we can release the CAP staff, if that's all right with you, the contract administration staff, just to preserve bandwidth. We'll just ask the homeless service system providers to stay on.
Okay, thank you.
Thank you.
Thank you.
And you can be visual or not visual, it's up to you. But please come back on visual if you have any questions or anything that might be slightly different. Please come on and state which department that you are from. And is Tracy Martin Thomas? Are you still with us?
Yes. Council Chair, can you hear me?
Yes.
Okay, I'm sorry. I've been having some tech issues this morning, so I apologize for that. ITS is here trying to work through some of those challenges for me. But thank you so much for having us here today. My name is Tracy Martin Thompson, and I am the Chief of Prevention, Intervention, and Opportunity for Youth and Young Adults in the Office of Mayor Frank Jackson. And the Cleveland Department of Public Health is one of the departments in my supervisory cluster that I'm responsible for supporting. So joining me today, I have the Interim Director of the Cleveland Department of Public Health, Brian Kimball, and also our Medical Director, Dr. Lynn Milliner. So today we are here to provide the members of council an update on the City of Cleveland's vaccine distribution efforts. We'll also talk to you a bit about the vaccines that we are administering, talk about why it's important to get vaccinated, of course, and try to dispel some of the myths associated with the vaccines. However, before I get started, I think it would be helpful to provide members of council a little bit of context and background about the Cleveland Department of Public Health. The Cleveland Department of Public Health is committed to improving the quality of life of the approximately 398,000 residents we serve by promoting healthy behavior, protecting the environment, preventing disease, and making our communities safe and healthy places to live, visit, work, and play. We do this by providing direct clinical care support to our residents through our 2 medical clinics, J. Glenn Smith and McCafferty, engaging in efforts around prevention and health promotion, licensing and permitting, monitoring and inspecting, and educating and informing the public. The department consists of 3 active divisions, the divisions of health, environment, and air quality, and 1 new division that is in development, and that is the Division of Health Equity and Social Justice. The department employs approximately 140 committed and dedicated employees. So again, I want to thank the members of council for having us here today. I'm going to now turn it over to my colleague, Director Kimball, so he can provide you an overview as to where we are with our vaccine distribution efforts. Director Kimball?
Thank you. Good evening. Not evening. I forget what time it is. Good
Too many Zoom
afternoon.
calls.
I know.
Exactly.
I've been here all day, right? So good afternoon, all. Today, my goal is to really provide an update on the results of our vaccine program and our future plan as it stands now. We've seen over the past few weeks, we have seen a slight increase in the vaccine allocations from the state, which is good news. The other good news is that in our community now, we have, for the next few weeks, the FEMA pod or the mega pod at Warstein Center, making vaccine available to many more eligible individuals in our community. And that's a good thing. I would like to talk a little bit about our progress and what we've done thus far. Initially, we set up our initial pod on December 21st. And since then, through March 30th, we have administered a little over almost 43,000 vaccines. That's the first and second dose. So I think that's a huge accomplishment. In addition to that, we've set up over 100 pods in various locations throughout the city. Our primary locations have been at our public auditorium, in which we served our frontline workers and some of the medical communities that were eligible at that time. But since then, since those weeks, we've been setting up pods or points of distribution for vaccine at our local recreation centers. And we've identified a number of these recreation centers in our communities, in those communities and neighborhoods that we believe are underserved, to make vaccine accessible to them. We were on the northeast side, Collywood. We've set up pods at Gunning, Zelma George, Cadell, Thurgood Marshall, Estabrook, are some of those locations that we have set up. We've also partnered with Cleveland Municipal School District and allocated and helped administer vaccines to our K through 12 staff at those schools and throughout this area. We thought that was a great partnership, and we have also partnered with them to help or to stand up a pod for the general public at East Tech High School. So we've been working with a number of different agencies throughout the city here. Over the last few weeks, we've worked with Case Western Reserve, who've helped us administer over, I think probably we're up to 5,000 doses with them. They've been an excellent partner with us and done a marvelous job in outreach and education. We've also partnered with MedWorks. MedWorks is administering vaccine at our faith-based locations at a number of churches they've identified in underserved communities. We've been partnering with them to administer vaccine there. And we've also partnered with our FQHCs, our Federally Qualified Health Centers, also to assist us in providing vaccine to our community. And we will continue to leverage these partnerships in order to maximize our effort to reach a higher, our highest need populations. But also, we've recognized our vulnerable populations that have mobility challenges. And we've partnered with a number of agencies, including Cleveland Clinic, the State Health Department, Adams Board, and others to help us get to those locations, those congregate living sites that we know have challenges that they can't come to our pods. So I set up what we call mobile pods, and we went to them and we administered vaccines to those agencies, both Are you all receiving feedback? Okay, I was just hearing that. So we've continued to partner with those agencies to help reach that population. We are looking to, in the near future, of identifying, and we've been collecting information on homebound seniors and how do we serve them in their homes. We're working on the details of providing vaccine to that population. Through our partnership with Cuyahoga Board of Health and Metro Health and the county's Office of Homeless Services, we were able to allocate over 800 doses of vaccine to provide to homeless shelters, both the workers and the residents there. And we will continue to build on that partnership and continue to allocate those doses to administer to that population. But I do want to mention one of our routine meeting that we have bi-weekly is with the county DHHS in helping coordinating our COVID-19 activities so that we're all on the same page and moving forward. In that form, we can share information about our pods. We can share our challenges, and they've been assisting us in a number of ways, connecting to congregate living sites to the shelters. So it's a wonderful partnership and a standing meeting that really provides a lot of benefit to us in providing this vaccine. So this week we have a number of pods set up, a number of clinics where we're going to administer vaccine to in the community. Today we're at 2 churches and we're partnering with BedWorks to help us administer those vaccines. On the east side, we're at St. James AME along with Bethany Baptist Church. We also have a partnership with the National Guards in which we serve as and oversee the vaccine that they administer at senior buildings. And so today, the National Guard is here to administer at a couple of senior buildings, one on the east side, Mark's apartment building on Lee Road, and on the west side, they're at Deaconess Zane Center, administering second doses to those residents there. As we move through tomorrow and the remainder of the week, we will administer at Case Western Reserve again. We have 2 clinics set up there, one on tomorrow, Thursday, and one on Friday. These clinics will be administering first and second dose. Case Western Reserve is, again, has been a great partner and able to go out, help educate the public and help schedule those appointments there at their facility. On Saturday, we will be administering our second dose at Thurgood Marshall and at Zelma George. And we have a first dose clinic set up on the east side at Zion Missionary Baptist Church. So I'll pause there and take any questions.
Yes, Director Kimball, on your last point, you've named several, because we're about equity and racial equity and just equity in general. I didn't hear any west side or southeast side pods. Yeah. Can you speak to that?
Certainly. Madam Chair, what we're trying to do is alternate. We've established what we call flagship pods. These are locations, primarily they are recreation centers that have been identified on the east, west, north, and south side of the city. And we routinely schedule events there. This week are these second clinics or second dose clinics that are set up from the initial first dose clinics that we set up in those neighborhoods. Next week, we will begin to move into other areas back on the west side to administer vaccine there. So it's a rotation that we develop to try to administer the vaccine in those underserved communities.
All right, and since you have this big partnership, how is the data being kept? Who receives, throughout all these partners?
So the data is kept. We're part, or we're part of each of these pods. If we're receiving the vaccine, we are the gatekeepers of that data. That data is retrieved at the end of each event. And our staff takes that data and uploads it into the state's database.
Okay. Primarily, even though this is general knowledge that we all need to know, primarily this presentation was asked because we're in a partnership, so to speak, the county and the city with homeless services. And so I wanted to know a little bit more about the vaccines for another vulnerable population, which is the homeless citizens in our county, and to make sure that they were receiving the vaccine, which vaccine they were getting, and how we were keeping records in terms of those individuals. So if you could address some of those items.
Certainly, Madam Chair. So in that partnership with CCBH and Metro Health, we're providing the vaccine. Metro Health is, and CCBH are leading administering the vaccine to the homeless population. So to date, we have administered, let me answer one of your first questions was, which vaccines are they receiving? So thus far, we were allocating the doses or the vaccine that we had at the time, and that was Moderna. So we allocated 500 doses of Moderna for our first initial round of vaccine. And those began on, I think, February 19th. From those 500 doses, all 500 doses were administered through that month. Since then, we have allocated 300 doses of J&J. That is still underway. They're still administering that. They have administered, the team has administered, I think, around 20 doses of that vaccine. Yes, 20 doses of J&J. And they're working on scheduling the additional, the remaining doses. Excuse me, it was 60 doses of J&J was administered through the 30th of this month.
I know I have a couple more questions, but I want to open it up on the presentation thus far to my colleagues. Are there any questions? Councilwoman Brown?
Did I
came back on?
Thank you. Did I understand you said of the 360 of the J&J shots have been administered?
So we allocated 300 doses of, they have administered about 60 doses there. So that was our most recent allocation of J&J. We have not, that was actually, that was our first allocation from the state that we received of the J&J vaccine.
What will happen with the remaining 240?
Remaining doses are being scheduled out by the team at Metro Health and CCBH that are administering the vaccine.
And that's to the homeless population?
That is to the homeless population, correct, yes.
How is the Spanish-speaking community being serviced?
So we know that that's an area that we have to improve. We've set up our meaning to the general public or the eligible population. We've had a couple pods on the west side, Gunning Recreation Center, Esterbrook this past week, and in Cadell to help administer or provide to the Latino population. But as far as the doses that have been allocated for the homeless population, I don't have that data.
Okay. That was one of my questions. And also on a separate but related note is the contract traces for the COVID-19 for the Spanish speaking community and how that was being handled by the city of Cleveland, because as a elected official who represents both the suburbs and the city, it has been brought to my attention as you with respectfully pointed out, that's an area that needs some improvement in the city. So if there what efforts are being done to address that?
So we currently we are looking at bringing on board additional staff, temporary staff in contact tracing or initial interview areas. We haven't brought on individuals yet. We're reviewing applications and resumes to make that determination. With the slight decrease in the number of cases we had, we don't have an immediate need to bring on someone new and not have or to lay additional staff or current staff off. So as the need increases, we will be bringing on new individuals to help us with that. But there are other areas, temporary areas, staffing that we're looking to bring on that definitely we're going to look at Spanish-speaking individuals to fill those roles.
Okay, just so I'm clear, Doctor, so you said that you will be seeking to bring on more Spanish-speaking?
Yes, that is correct.
Do you have a targeted date for that? Because I can.
I do not. I don't have a target date for that specific to that.
But you do have candidates you said you've been interviewing for?
Yes, we do have candidates.
Thank you, Madam Chair.
All right. Any my other colleagues have any? Councilman Sweeney.
Thank you, Madam Chairwoman. Chief Martin and Director Kimball, it's nice seeing you again. Just a thought on the way you described the rollout of the vaccine in the sites. With the Wolstein Center, it's running well, but I think most people in the city of Cleveland are kind of intimidated by the size and scope of it. And in the rec centers, whoever made that call, it's just a comfortable place for the citizens of the city of Cleveland in their neighborhood rec center. When they walk in, it's orderly. And it's the people are kind of proud. I went to Gunning today to get my shot, or I went to Cadell. I'm looking forward to going. And Madam Chief, when you were talking about the partners, I just want to throw a little shout out to the Department of Aging with Director Mary McIntyre. I mean, or is she just McNamara? I'm sorry. When I walked in, she's there, and the people were trying. When the older folks walk in and I didn't register, how do I go about doing it? She took them under their wing, and if there was some left over, they came back. Just orderly and rather, extraordinarily well ran, and just the feel good nature of coming to their local rec center instead of just a place to swim or work out. It was just, I had firsthand a witness of it. I just want to say, keep up the good work, basically.
Yeah, thank you.
In terms of the homeless population, do you feel, Director Kimball, that we have gotten to every site, every hotel, every shelter, or is there still a need?
There is still a need. I'm going to work with the team to assess that. So we're going to continue to allocate those doses that are needed based on the assessment that's done. So I don't see that this will be the last time that we supply that vaccine that we have to this group and this team that's helping us with this.
Okay. Is there a protocol set up for daily we could get through central intake, we could get some new individuals that need to join our shelter for one reason or another. Is there some kind of system that is set up to address that, particularly with I believe it's Frontline that rolls out the initial intake, where we could at least keep track of those individuals that might be coming in, so we don't miss anybody.
Right, yeah.
Madam Chair, may I add? I can answer that. Director
Yes.
Kimball, if you don't mind, I can add.
Please.
Thank
Yeah,
you.
please state who you are. Melissa.
Sure, Melissa Surak, Director of the Office of Homeless Services. So currently, we are still working through the process for new residents that are entering the shelter. Thus far, it has been relayed via the providers reaching out to myself or the Metro Health team in order to get those individuals scheduled. We've also offered, of course, other community resources for those individuals that are available to them in the meantime. Coordinated intake will definitely be a prospective answer to this as we roll out how do we do the next wave of vaccinations. To some of your earlier questions, we have made it to all sites that would be listed on my continuum of care list for first vaccinations, offering multiple vaccinations, as Director Kimball mentioned. I worked closely with the Metro team to strategize around the J&J vaccination, such as looking at the hotels, knowing that we're making a movement pretty soon and ensuring that those individuals might be better fit for J&J so that we don't have to worry about, the second vaccination and then them receiving that dose. Overall, our continuum of care has had about an 88% response rate to receiving the second dose. And I think that that's amazing. We weren't sure what to expect when we first started this initiative, but we've averaged 88% receiving both doses thus far.
All right. Does that include, I don't know if we still have individuals that currently have COVID and are kept separate and quarantined. Has conversations been or a protocol set up to deal with those that are coming out and all of that?
So I won't speak in regards to those that have already had COVID receiving the vaccinations. What I can share is that it has hit all populations. So those would be offered to the individuals that worked at the site and also stayed at the COVID hotel, all the continuum sites, the hotels for deconcentration, as well as the unsheltered individuals that we're serving within the systems as well, and the family shelters, of course. So it would have been it should have been offered to them.
Okay. Any other questions from my colleagues?
Madam Chair.
All right. Councilman Miller.
Thank you. I just also want to give a shout out. I went twice to the Zelma George Center for the vaccine in Cleveland, and I found it to be very orderly, very well run, very well organized, and it just was a tremendous service, really well done. So I just want to give you a good word.
All right, thank you, Councilman Miller. And from the City of Cleveland, Director Kimball, who is responsible for the chain of the communication for all the information to be communicated amongst all the parties?
I've been serving, Madam Chair, I've been serving as that point person.
So that means that you keep, I know all the partners that are working under the umbrella of City of Cleveland, you're the point person for that, but you meet once a week with the county's public health. So you're the point person that will keep that communication going with
Madam Chair, that is correct. Yes.
Okay. All right.
Madam Chair.
A couple more things. Administrator Merriman, yes.
Yeah, hi, David Merriman, Director of Health and Human Services. I also just want to acknowledge that Director Kimball joins a biweekly meeting with Health and Human Service leadership, and where we provide both Director Kimball as well as Commissioner Terry Allen and Dr. Heidi Golette access to the human service leadership to have us report to them what we're working on and what we're hearing, and have them share with us anything they need from us as well. So I want to acknowledge that Director Kimball has just been extremely accessible, very responsive, and an excellent partner in our work. I think our ability to manage our networks has definitely been greatly improved by Director Kimball's openness and partnership.
Thank you. And just to let you guys all know, if you do not know, this has opened up live stream for not just the internal HHS committee to hear these questions. I may know the answers to some of these already, but I feel it's very important to have the community hear, because miscommunication is carried usually from one mouth to the other. So this is a very important topic. And so it needed to be brought out live stream for everyone to be able to hear what's actually going on within with the partnerships of all the communities in relations to COVID-19. And City of Cleveland is a big partner of the counties. And so we want to make sure that they are fully have full knowledge of what's going on as well as us. I'd like to continue my questions on just on a couple of other topics. I've been reading lately that some states have some waste that may or may not be going on. And so I just wanted to cover our bases in terms of the COVID vaccine, because I know it is for a limited time. I do not know what the time the vaccine is for. So if you could share that with us. And does the City of Cleveland, do you have a responsibility to keep track of those wasted vaccines, or is that solely the state?
Madam Chair, to your question around vaccine waste, we do track that and we report that to the state. And I can tell you that we have not experienced much waste. Certainly, there have been some syringes that may have misfired, meaning that the needle was not connected to the syringe, and there may be it's not usable, but it's minimum based compared to the number of vaccines that we've administered. I think the last count was 9 of those types of incidents. But as far as wasting, and I think the thought is that at the end of the day, there's vaccine left over. That's not the case ever. At the end of the day, we ensure that all vaccine is administered to someone. So at the end of the day, if we have any remaining doses, we will go as far as going outside of that clinic to knock on doors. We make calls to from our wait list to ensure that people are made aware that we have either extra doses available or that we have some doses where individuals did not show up. So we have not wasted any doses in that manner.
All right. I don't like the term waste, but that's what the internet kind of uses. So, I know there is a certain period of time that that they're viable for, and just hearing some of the suburban communities say that it's very hard for them to have access in getting the vaccine. So I just wanted to make sure that we have connectivity with all the mayors and the municipalities. So these things because it was so hard for us all to finally get the vaccine and to have enough. We want to make sure that they're utilized. So you would say that there is a partnership with the City of Cleveland and other municipalities to have access to any vaccines that may be left over for that day?
Yes, it is available to, now our primary primary target population are residents in the city of Cleveland. However, we do administer the vaccine to those that are eligible. For instance, when we serve the first frontline workers, a number of frontline workers work or live outside the city of Cleveland, and we administer to them. But we don't turn people away. We try to target and provide that resource to residents of the city of Cleveland.
All right. But there are some exceptions.
There are some exceptions, yes.
Okay. In terms of eligibility, where are we today as of this time? What is the age group that is eligible?
So as of last Friday, when the governor opened it up to individuals 16 years and older. So it's open to pretty much everyone who's of age.
Okay. And at this time, I'm coming to my colleagues, I'm kind of rounding up with the end of my questions. So if you have any others, please prepare them. At this time, no initial clinical trials or for the COVID-19 vaccine. Does that include children? Where are we at with that? I'm sure you guys are getting more up-to-date information in regards to that.
Hi, it's Dr. Milliner for CDPH. There actually are some ongoing clinical trials in the city of Cleveland and surrounding suburbs. I know there's a suburban pediatrics office right now that is doing clinical trials in children. So those studies are going on as we speak. It is guesstimated, and that's probably the wisest word to use, that we might be able to vaccinate younger populations sometime in the fall. So that's an optimistic option, but we're hoping to get to that point. But the studies are going on now.
Okay. So that there is a rollout plan, since that is the optimism of sometime in the fall. There is a preparation being made in terms of how we will address that with parents and for the children to get inoculated. Those parents that would like their children to get inoculated.
I'm actually hopeful that that process will be, streamlined and well thought out and planned for by the time the vaccine rolls out. I mean, we've learned a lot of lessons in how it's rolled out for the adults. So I'm hoping some of those valuable lessons learned will help the process going forward for the younger population.
Okay. All right, because I know that is the next big focus, and just to ask and to put on everyone's minds, we do have children that stay in the shelters. So when those thoughts are planned out, let's be inclusive of those children that have to live in our shelters as well. I want to open it up to any other my colleagues, any additional questions that you have from any of the City of Cleveland team? Okay, seeing none. Is there anything else? Okay. Is there anything else, Director Kimball, that you would like to share with us that we haven't discussed today that we may need to know?
Well, I just want to extend my gratitude to everyone on the call, on this call. This has been a wonderful example of collaborations when they work. A lot of the efforts that have been put forth and a lot of the successes that we've experienced as a community is because of collaborations that were shared today. So I want to thank CCBH. I want to thank the Health and Human Service Division and this board for collaborating with us to provide this service to our community.
Director Kimball, can you send to, and we can have staff reach out to you so you know who to send it to. I think you guys have had conversations and emails with Ashley our Madam Clerk for today. If you could send a list of your partners, as well as, especially, I'm interested in the pods that have been set up, the areas that the pods have been set up in the rec centers. You have many of my colleagues that have a portion of City of Cleveland within their district, and they may want to know that information.
Absolutely, yes.
All right.
If I may,
Is there
Madam
anything
Chair,
else?
Madam Chair, if I may, I just want to.
All right, Chief Tom.
Just one point of clarity, speaking to Council Member Chantel Brown's question as relates to having Spanish-speaking individuals available in order to respond to individuals or work with individuals through the contract tracing or through our call center. One of the things I want to point out is that we currently have our language line in place. So if there is a non-English speaking person who contacts our call center, or we have to reach out to an individual through the contact tracing process, we utilize that language line now. We've also issued an RFP so that we can increase the number of individuals that are actually staffing our call centers and staffing the contact tracing group. And we have requested to include bilingual individuals as a part of that process. And also we're working through it with a temporary employment agency to hire bilingual individuals, again, in order to support contact tracing efforts as well as our call center. So I just want to make sure that we added that point of clarity.
All right, Councilwoman Brown. Is
Thank
that satisfactory?
I guess it still doesn't give us anything definitive that I can take back to the people that are asking me around the number of people that they're looking to hire or the time frame in which they're making these efforts. But I do appreciate understanding that you are doing the best that you can to try to address the issue. So if you could, when you have something more definitive that we could share, that would be increasingly helpful, because even though I don't have a large Spanish speaking population, I get a lot of folks reaching out to me around this issue by mutual acquaintances. So I appreciate it. Thank you.
Absolutely. Thank you.
And definitely Chief Thompson and Director Kimball, we will invite you back and Dr. Milner, since she stated that somewhere in the fall, we hope to have the vaccine for the children, so we can hear more about your rollout plan before it actually initially takes place, which I would say fall, they usually go back to school at September. Dr. Milner, do you suggest September or October? Or you're looking later in the fall? If you're still,
That's a good question. I would probably maybe think to do it around August, right before school starts, if it looks like we've gained a lot of momentum and we've started. If it doesn't, then it could be a little bit later. But if the studies and numbers are looking good and it looks like we'll get it done early fall, then I would do it late summer. And then if it looks like it's going to roll into late fall or winter, I would do it in the fall, would be fine.
okay, so our policy analyst, Ms. Levine Ross, will stay in contact with you, Chief Thompson, so we can get that scheduled and, okay.
Absolutely. Thank you.
Councilman Sweeney.
Thank you, Madam Chairwoman. Just on my colleague, Councilwoman Brown's comments, I have a significant Hispanic population in the district I represent, and I'd like the same information that I can be able to share when I get the phone calls as well, either the director or the chief. So I thank you for listening, and I look forward to seeing it when it's available. Thank you, Madam Chairwoman.
Since in speaking about the Spanish population, it did come to mind in regards to the Asian community. I have Spanish population as well as the Asian community, and I was at the Stop the Asian Hate Walk Sunday, and that was one of the things that many of them did state when they presented was that it's been very hard for them to be included, I guess, with the vaccines. Could you speak to that, Director Kimball? I know the city of Cleveland does have an Asian liaison department.
So we're going to work to improve in that. That's another area that we recognize that we have to improve in, and ensuring that one, receive the information in language in which they can read and understand, and two, have someone that they can reach out to and from our department that can help them along the process. So as we begin to staff or increase our staff at our call center, we will be looking at this as well.
And if I could add, Madam Chair, I'm sorry, if I could just add, Madam Chair, one of the things that we're also doing is working with our Community Relations Board. As you noted, we do have Asian liaison through that particular department. So we are enlisting the support of that particular individual to help us to make some connections. And we are also beginning to identify sites located in those particular dense communities where we have a lot of our Asian population reside. So we are working to identify locations in those particular areas where we can set up pods specifically for that population.
Okay, and that's what I was going to state, that, and that's Miss Chai Ming.
Yes. Chai, yep.
Because I work with her. I miss her. She's not at the office right now, but yeah, that's what I was going to suggest, that there's some individuals in the Asian community that I could connect you to, but I will I'll reach out to Chai Min via email today and see where she needs my help in that area. If you need some other contacts, because they if the city of Cleveland is looking for new staff, they have many of their young community folks that can interpret and speak, Mandarin and all the various languages that they have. So that would be a good, the AAPI organization would be very good in terms of getting those young folks that might be in need of a job to do just this, to help with the translation of services. So if there's nothing else holding our attention, I will go one last call. Any questions from my colleagues while we have the city of Cleveland available to us today? I know there's a lot that we could ask with COVID-19. I think you guys have done a wonderful job in respects to rolling out and making sure that all the residents are covered. We know we have many that are still in the houses, scared to come out. And then there's the digital divide. So I like that you guys have brought it to the rec centers to make it available for those that do not have access to computers to register for a COVID-19 shot. So the phone calls, the phone lines, it was very much needed to roll this successful plan out. So again, thank you all for your time and attention today. And if there's nothing further to hold our attention, is there any miscellaneous business real quick? Not hearing any or seeing no hands. We do have a committee of the whole. You all have a good day, and thank you once again for joining us.
Thank you for having us.
See you, Commish. See you, Director.
Bye.